The COVID-19 pandemic and the subsequent lockdown has changed the lifestyle of people globally. Just as it has affected every industry, there has also been an effect on architecture and architects. This video presents the impact of COVID-19 pandemic on architecture. All the data presented here has been extracted from the articles and news items posted on the internet. This is part 2 of the video series. I am architect Archana Agarwal. In part 1 of this video series, I had discussed the changing needs and the expectations of people from the living spaces and from the workplaces after the outbreak of pandemic. In continuation of part 1, I am going to deliberate on post-pandemic architectural designs in this part of the video. And now we shall look at some architectural typologies based on the concept of social distancing. As countries around the world begin to lift lockdowns with strict social distancing measures in place, architects are developing innovative new approaches to everyday spaces that support greater separation between occupants. We are going to look at some of these projects that have been proposed to tackle this challenge. The schools are beginning to reopen, but adapting existing classrooms to socially distanced learning is proving challenging. This proposal contains a pop-up solution in the form of a series of circular tents, which enable students to be spaced at a distance of 2 meters from each other. The tents are designed to be erected on existing school land and also minimize the risk of infection spreading by enabling greater air circulation than traditional buildings. Italy tackles the social distancing issue from a more conceptual approach by painting a 1.8 meter grid of squares across the space. This reflects the official distance recommended of the region of Tuscany and is designed to serve as a visual prompt to help people safely move across the square. It has also been painted in water-resistant, removable paint so that it can be easily removed when the pandemic is over. In many parts of the world, public markets have been forced to close, putting increased pressure on the other parts of the food system. This is a concept for a network of public markets that respect social distancing measures. Hyperlocal micro markets reimagines existing public markets by breaking them up into dispersed mini markets containing 3 stalls, each scattered across city neighborhoods. These are individually structured using a grid system, which enables shoppers to visit and purchase items by moving through a series of squares, preventing them from getting too close to one another. The restaurant industry has struggled particularly badly amid the coronavirus, with many businesses forced to shut completely. While social distancing measures are in place, the traditional restaurant design is more or less impossible to support. This design is to combat the problem by turning public spaces into a gridded environment with clearly defined zones for outside eating and safe movement. The first prototype of this project is already installed in Czech Republic. The architects are in discussion with cities to create similar safe restaurant zones in other parts of the world. The furniture is also designed to be reused after the pandemic as public seating or in playgrounds and parks. The dining set has 3 seats around a round table. It is designed as a one-piece construction that is freestanding and non-movable and is made out of materials that can be frequently disinfected and cleaned. Many of those in lockdown have missed access to public space, and many public parks and gardens have been forced to close due to the inability to support social distancing within them. This architect has envisioned a public park that overcomes this problem by using planting to create a fingerprint-like configuration of paths that keep visitors apart. Snaking across the park are numerous entirely separate paths, each 90 centimeter wide and distanced by 240 centimeter from each other. Each has its own entrance and exit from the park, with a gateway that allows visitors to indicate if the path is in use or not. The park is envisioned for a vacant plot in Austria, but is designed to be replicated around the world. For now, the park is designed to create a safe physical distance between its visitors. After the pandemic, the park will be used to escape the noise and bustle of the city and be alone for some time. After seeing some designs for social distancing, let us now look at the design for healthcare facilities. The coronavirus has had a significant effect on healthcare, with a surge of new temporary hospitals requiring architects to come up with innovative solutions to convert existing spaces into healthcare facility. But how could it impact long-term healthcare design? The COVID-19 outbreak has pushed healthcare facilities around the world to their limit. Authorities have been forced to take urgent action to address the rising demand for beds. To alleviate the burden on hospitals, a number of temporary healthcare facilities have been needed. Collaborations between governments, architects, builders, suppliers, and even the army have happened on a scale and pace rarely witnessed during peacetime to meet the extraordinary challenges. Staff shortages were a challenge already before the pandemic, and now for everybody it's a war going on. So all driving forces go in one direction. But we have to design healthcare environments that will last for the long run and that will also be reliable environments for the staff to work in. These were the words of a Sweden-based architect. In England, 7 temporary Nightingale hospitals have been established, taking over venues such as event centers and indoor arenas to add approximately 8,000 beds to the nation's capacity. This is in addition to a further 10 field hospitals dotted around the UK. In Manchester, the Nightingale Hospital is situated in the Manchester Central Convention Complex, which is covering around 14,500 square meters. With barely any notice, design and construction teams sprung into action to get it built. The time frame to design and build the interior of the temporary hospital was significantly short. All the design and construction activity happened on site at the same time. Normally, to deliver a 750-bed hospital would take between 4 and 5 years, but they did it in a few weeks. Aside from the tight time frame, what made the project all the more challenging was that Manchester Central Building was not designed for healthcare use. What makes COVID-19 a unique challenge for healthcare facilities is the virus's high infection rate. As a result, the designs needed to carefully consider the best ways to minimize the transmission. The architect says we had to very definitely separate the red zone, which is COVID infected zone where staff needs PPE. To separate the red zone with the amber zone where staff are in scrubs unless coming into contact with infected patients. And then there is a green zone where all the goods, all the food, all the stuff could come into the infected space, but via safe routes that staff not necessarily wearing PPE could use. Getting that flow within the constraints of the existing building was quite a challenge. To get the food, the linen, and all the clean consumables into the ward, we designed a pass-through hatch which allowed people on the green side to not come into contact with surfaces and staff within the red zone, which meant the building could operate really very efficiently. In a hospital in Sweden, operation theatres have been converted into intensive care units for coronavirus patients. The architect says, we designed 23 operation theatres. In Sweden, it has even become a standard now that we locate operation theatres along facades instead of having corridors along the facades. This is to bring in the daylight, to create a healing environment and attractive working environment for the staff. This particular project was supposed to be open for operating procedures in April, and then the pandemic came. So the 23 operation theatres were transformed into intensive care units for 3 patients in each OT. Equipment for surgery, the gas, the monitors and everything, they were taken out. And the equipment that came in was for respirators and intensive care. Why was this possible to actually convert operation theatres into intensive care units? It was because of daylight and HVAC system, as ICU requires high airflow compared to standard patient wards. We all know now that testing facilities for COVID-19 are essential. And we also know that there is a shortage of such facilities in many parts of the world. So an architect has proposed a solution in the form of a series of mobile testing units that are clad in a copper alloy, which is a surface that the virus will die on faster than almost any other material. Designed as a vehicle mounted trailer, this can be easily moved, and the unit provides space for testing staff inside, while visitors can queue at a safe distance to take tests one after the other from any of the 4 windows. The architect has proposed that 6 of the trailers be used across the city of Los Angeles, California, which would collectively be capable of carrying around 3,500 tests per day. The inability to see elderly relatives has been a particularly challenging part of the pandemic, leaving many people feeling very isolated during the outbreak. An architect has proposed a solution in the form of a movable pod that enables families to meet with their relatives, divided by a perspex barrier to prevent the transmission of the virus. The pod is also fitted with integrated microphones and speakers to enable sound to be transmitted between the 2 sides. and a small panel of flexible plastic enables relatives to hold hands without risking skin contact. It is lightweight, rapidly constructed, and is easily transported on the back of a standard truck or pulled on a trailer. Importantly, it's been designed to be fully sustainable so that pods can be repurposed or recycled with relative ease when they are hopefully no longer needed. And now let us look at the digital revolution. Architecture's digital revolution is well underway and yet still far from complete. Architects' way of working are changing. Tools such as augmented reality could one day see the same level of adoption as BIM or cloud computing. A report by the name of Digital Transformation in Architecture has been published jointly by Microsoft and the Royal Institute of British Architects. According to this report, some 39% architectural practices say that they are still in early stages of digital transformation. 5% of the firms believe that they are well on the way to completing their digital transformation journey, and 0% say that they have reached their destination. Some 70% of the firms are already using BIM, that is Building Information Modeling, to generate virtual representations of their buildings and designs. Likewise, more than half of the firms are also using social media, collaboration tools, cloud computing, and mobile apps. Yet, there is still plenty of potential to be unlocked. Immersive technologies such as virtual reality, augmented reality, and mixed reality, for example, are often tipped as the next big thing in architecture. Since these technologies have the potential to bring 3D design concepts to life, there is a drive towards the digital revolution. Currently, 35% of the firms are using these technologies, and additional 29% plan to invest in mixed reality within the next 5 years. However, there are about 36% who are uncertain that their use of immersive technologies will increase within the next 5 years. Cost is the biggest barrier for adopting these technologies as per around 70% of the firms. However, a lack of support from senior management and unwillingness to radically change the operations, also slow decision making, are some of the reasons for holding this advancement. The study found that many architects were already seeing their way of working change as a result of technological advancement. Some were already using technology to communicate with clients, while some expected that remote communication would increase in the next 5 years. However, there were some who did not expect technology to change the way they communicate with clients. But those firms in recent months had no choice but to rely on technology for communication because the coronavirus outbreak forced the offices to close and also limited the travel both nationally and internationally. The London-based architect says a digital revolution within the industry has been underway for quite some time, and while the sector has not been the fastest in adopting this change, it could be said that COVID-19 has forced some architects out of their comfort zone. Many have struggled with this sudden change, with 30% reporting that they faced new communication difficulties, according to a study carried out by RIBA. However, coronavirus has helped to accelerate the industry's adoption of technologies that enable projects to progress even without face-to-face interaction. Positively, it has made many within the industry realize the efficiency, cost, and quality implications of embracing these technologies. The lockdown for a studio has highlighted the value of real-time rendering, which makes it easier for architects and clients to visualize and test their designs collaboratively and remotely. Using BIM software plugins such as Enscape, architects can render visuals in a matter of seconds that update instantly if changes are made to the CAD files. The firm has also been testing a beta version of the Grasshopper plugin for Revit, which provides live time and cost analysis in line with every change made to the design. Information like this has the potential to be linked to the factory process and support scheduling to deliver a project efficiently, says the architect of a studio. For many architects, lockdown has allowed for the implementation and refinement of remote working and also provided a base to further the implementation of technology. Governments will continue to ease lockdown measures and firms will eventually return to the office when appropriate, necessary and safe. However, coronavirus is likely to have a lasting impact on the way technology is going to be used in architecture industry. Recent conditions have encouraged the use of digital tools and hopefully helped to change the mindsets, and in doing so, substantiate a long-term positive impact on the industry as it starts to make progressive steps in an increasingly interconnected world. With online meetings, online presentations, and use of advanced softwares for efficient working, the architecture industry may see a dramatic change post-pandemic. The architecture, engineering, and construction sector has often been considered as lagging behind in digital advancement. In a recent survey, 50% of those in construction industry admitted that they had been slow to adopt digital technologies, while 49% of architects believe architecture is behind other construction professionals in adopting digital technologies. However, architecture's use of technology is improving. By 2023, many firms expect to be using some form of artificial intelligence and machine learning. Artificial intelligence technology offers plenty of potential in architecture, from valuable long-term user testing to its use in construction through robotics and 3D printing. The use of smart digital assistants and Internet of Things will also see adoption increase considerably. However, the biggest jump will be in the use of immersive technology. Mixed virtual and augmented reality use is going to be adopted widely by 2023. A well-known architectural firm says, "We are keen to think about how we can make use of virtual reality software more with programs such as Unreal, where we can inhabit spaces in 3D, walk around, and test out ideas with clients, collaborators, and wider teams." We are discussing buying the scanning software to enable us to do more remote working with clients at the initial stages, and how we might use virtual reality to lead clients through projects where it is more practical to work remotely rather than travel for meetings. Besides seeing the firms through the pandemic, technology is also helping to solve longer standing issues such as the performance gap between design intent and a building's fabrication, says the London-based architect. Real-time testing of intelligent models incorporating performance criteria would ensure that all information can be considered at the earliest stages possible, allowing the architect and the design teams to design out this gap. A regeneration project to bring 750 new homes to London area offers an example of this in practice. The A Studio firm has created a 360-degree virtual environment accessible over the web that allows clients and residents to visualize and test the space before the project commences. This in turn helps to ensure that the eventual outcome matches the initial intent. The architect says that with a lot of new digital applications developing from gaming platforms, new design processes are quickly emerging as new generations enter the industry. So we expect this sophisticated software to continue to evolve. Aside from how technology is used to improve architectural practices, the industry must also consider how best to incorporate new technologies into their buildings. The pandemic has altered what we want and expect from shared spaces, and technology offers potential solutions to these new concerns. Disease prevention will inevitably form a significant design factor in the construction of new buildings, especially in workspaces. A UK-based engineering company explains this. Buildings are likely to become smarter as a result, with contactless technologies and increasingly sophisticated artificial intelligence systems deployed to trigger features within the building. Rather than manually controlling lighting using switches, for example, these systems would be able to detect when somebody enters or leaves a room and turns lights on and off accordingly. Not only will this help to improve the building's efficiency and subsequently reduce its environmental impact, but it will also help to eliminate a number of high contact points, including elevator buttons, taps, and door handles that cause germs to spread. Smart buildings not only make lives easier for occupiers, they also make them safer. Connected building access systems have introduced a range of features to make access control more secure and convenient for users. But as with any Internet of Things installation, cybersecurity is a key concern. The rise of connected IP-enabled cameras and access systems is transforming physical security and access control in offices and homes. Commercial installations came first, with offices and production facilities taking advantage of the benefits that networked systems can bring, from updating and customizing staff security credentials to accessing areas with no more than a tap of a phone. Physical security can be greatly enhanced when reception staff can see as well as hear guests via intercom before granting entry, or by the ability to connect CCTV cameras to alert off-site responders to unauthorized entrants. IP access control systems can also be customized with a range of integrated software bringing new features or security measures. And in 2020, it's not just offices and factories that can access these advanced IP functions. Modern residential building projects are increasingly baking IP security systems into the design and construction phases or retrofitting them into existing developments. For tenants and homeowners, the ability to respond to their doorbell remotely or even grant access to pre-agreed visitors while they are out is an upgrade in both security and lifestyle. But making use of these internet-enabled features doesn't come risk-free, as is the case with any IoT device. Connectivity opens the possibility of cyber attacks from the outside. In this sense, a building's cyber resilience has become just as important as its physical security, and both must be guarded in tandem. A global provider of IP intercom and access control systems discusses the best ways to mitigate cyber risk in building access systems, the challenges of integrating third-party software securely, and the potential benefits of connected access controls amid the COVID-19 pandemic. Their chief product officer says there is one big advantage of the IP access control system, and that is the flexibility. For example, we have some corridors in our production facilities that we have split up for different shifts so the staff don't meet each other. You can tape an area off, but anybody can walk behind the tape. So it's more effective to simply change the access rules more dynamically. This is much easier with an IP-based access control system. We also have requirements from hospitals. I met a few people from one of the biggest hospitals in Czech Republic, and what they are challenged by is if there is a COVID positive patient. For example, they had a woman who was pregnant, and when she got there, she tested positive for COVID. But they don't have a quarantine for the team responsible for childbirth. So they had to create a quarantine in the surgical area for the childbirth, and they need to be flexible in that. So they needed to install an intercom to be able to talk to the patient, because anytime they enter the quarantine area, they have to cover themselves with a special suit, which is costly because it is then disposed of, and at the same time it's time consuming. They also told me that most of the infected doctors were infected because they didn't know how to properly take the clothes off because it's covered by the virus, and they need to be very careful while changing. These challenges are better addressed by the IP systems because of the flexibility. In April 2020, Zaha Hadid architects were the victims of a cyber attack. A hacking group stole a wide selection of files and encrypted the company's files using ransomware. They then threatened to release the data, which included private emails, bank documents, payroll records, and a wide selection of employee details on the web if the firm chose not to pay the hefty ransom the group demanded. Zaha Hadid Architects confirmed the breach notified the relevant authorities, and began restoring the files from backups. A spokesperson told that data protection and privacy is extremely important to us, and that is why we regretfully have to announce that on 21st April we experienced a security breach and theft of data in a ransomware attack. With all our 348 London-based staff working from home during this pandemic and cyber criminals poised to exploit the situation, we strongly advise the architectural community to be extremely cautious. The firm has reportedly opted not to pay the ransom, but it is not clear if the matter has been fully resolved. However, regardless of whether the firm pays or not, the situation is a wake-up call to the industry, which often does not pay adequate attention to cybersecurity, particularly given the amount of data it holds. From restaurants to offices, many commercial buildings are currently facing an overhaul in order to support post-lockdown social distancing. Here we look at some of the materials, fixtures and fittings that can be used to support social distancing retrofits. Cubes are modular partition walls integrated with Internet of Things technology that connects to a central control system. This means that not only can they be rapidly reconfigured to support changing layouts and staff sizes, but they can also be equipped with space utilization cameras to determine if staff are maintaining a space distance and whether certain areas are being under or overused. The walls feature add-on fascias that enable them to be fitted with whiteboards, TV mounts, shelving, or storage as required, and they can also be fitted with environmental air sensors and voice control. Glazed partitions are becoming popular to support social distancing without reducing staff density. There are a wide variety of options that provide both aesthetics and functional benefits. These include glass with built-in LEDs, magnetic and whiteboard panels, and opacity switching, as well as stained glass panels, digital printed and etched glass, and curved glazing. Mobile Reader Pro is an access control product which is designed to provide hands-free access to any door through a mobile or existing key cards or fobs. This means it can be installed in existing workplaces as a way to stop doors, turnstiles, and elevators becoming virus transmission points. It uses proximity sensor technology to detect a user's phone as they approach and automatically unlocks the door in question, removing the need to physically tap the sensor panel. And now let's look at some of the news items. In Southern California, outdoor dining changes the hospitality landscape. During the pandemic, outdoor dining has emerged as a lifeline for restaurants, but it has become something more. It's become a lifestyle. And as the pandemic fades, there is a sense of urgency to formalize and improve outdoor dining experiences among business owners and public agencies. The New York City Mayor announced the launch of the Open Boulevard program, an initiative that would temporarily close off car traffic on boulevard segments across several blocks, expanding the public space for dining cultural activities, and artistic performances. The project builds on the successful initiatives, open streets and open restaurants, which transformed the city's streetscape to better serve diners, cyclists, and pedestrians during the pandemic. After being shut down for more than a year, museums across the world are beginning to show signs of reopening. Most architecture and design events that were scheduled for 2020 have been pushed a year or two, depending on the severity of the pandemic in their respective regions. But while museums are open to the public once again, administrators have installed numerous precautionary measures to ensure the safety of visitors and curators and to avoid potential reclosures. Government of India's Ministry of Culture has issued exhaustive guidelines regarding standard operation procedures for reopening of museums, art galleries and exhibitions. Some of these guidelines are adequate physical distancing of at least 6 feet to be followed at all times. Use of face covers or masks to be made mandatory at all times. Sanitization of premises to be done on a regular basis. Availability of hand sanitizers, preferably in the touch-free mode, at entry and exit points as well as common areas within the premises. Adequate dustbins must be provided at key points with specially marked dustbins for proper disposal of masks, gloves and other equipment, especially those used by cleaning staff. Respiratory etiquettes to be strictly followed. Self-monitoring of health by all and reporting any illness at the earliest. Installation and use of Arogya Setu app. Periodical public announcements advising the visitors to follow standard protocols. Designation of on-site safety officers. Management authorities may establish a clear chain of command in case of emergency situations. In case of a suspect or confirmed case in the premises, place the ill person in a room or area which is isolated. Provide a mask till the person is examined by a doctor. Immediately inform the nearest medical facility. Risk assessment to be undertaken by a designated public health authority. Thorough disinfection of the premises to be taken up. Lift operations to be limited, preferably reserved for physically challenged or elderly persons. Crowding to be avoided. Vehicles to be permitted to the extent of parking space while observing due physical distancing norms. Use of digital technology to be limited, except in cases where disinfection can be ensured after every single use. There are guidelines for cleaning also, and there are guidelines for visitors' safety, like temperature screening for all visitors to be implemented, contact details of all visitors to be recorded to ensure tracking in case any positive cases are found. Visitors coming in vehicles may keep their belongings in their vehicles to avoid baggage checks. Use of face covers to be made mandatory. Body and baggage screening will be done by CISF, who should be equipped with PPEs, face shield, etc. The hand baggages of all visitors should be properly sanitized before allowing them. Adequate physical distance between visitors to be ensured, which can be done by use of floor markers to guide visitors and maintain a distance of 1.5 meter between each individual. Visitor numbers to be limited to avoid overcrowding. Social distancing is a must. Areas where visitors are likely to congregate should be identified and measures put in place to disperse them. Holding area with seats, if any, should be marked for seating as per social distancing norms. All visitors should carry online ticket as either printed or digital copy. Visitors may be provided with inexpensive disposable gloves. Time slots may be implemented. Maximum number of visitors per exhibition room will be defined in a way that allows a safety distance of 1.5 meter between each visitor. Separate flows of entrances and exits to be maintained and clearly communicated. One-way routes and space queuing systems may be introduced. Museums and galleries are encouraged to utilize their outdoor spaces and provide more outdoor art and culture experiences than indoors. Museums and galleries should also limit the use of their lecture halls, seminar rooms, conferences, and event spaces. Sufficient liquid soap and water arrangements to be made in washrooms, preferably with foot-operated devices. Entry of senior citizens, vulnerable groups, pregnant women, infants, and toddlers should be discouraged in closed spaces. Access should be denied to persons showing symptoms of the disease. Guided tours should be avoided. No group photos should be permitted. There are also guidelines for the staff safety. There are guidelines for display of signage and also guidelines for air conditioning. As we begin to emerge from the COVID-19 pandemic, there has been much speculation and debate about whether we will return to our old habits of working in the office 5 days a week, or if working from home creates equal or greater productivity. However, many believe that the future of the workforce will largely be focused on a balance between in-person and in-office working and a form of remote working that summates into a new hybrid model. But if you're not at home and you're not working, then you must be somewhere else, exploring the true in between of a public and a private space. Enter the concept of the third place, which is used to describe everything from coffee shops to banks and even co-working spaces. If you have ever studied for an exam at a bookstore or even dropped into an airport restaurant to catch up on some work, then you too have visited a third place. More than a year into this worldwide experiment of working from home, and we have not yet landed on the perfect formula for the workforce being once again in the workspace. Furthermore, not only has the working from home situation lasted longer than anticipated, it has embedded itself into the way we will work forevermore. As vaccines are rolled out, leaders of all types of organizations must now seriously consider how to handle the return of their employees to the physical office space. This is not an easy consideration. Consolidation projects, refurbishments, office moves, all these initiatives have been frozen, and their slow reactivation is occurring amidst an atmosphere of uncertainty and a difficult mix of cynicism, reluctance, and even fear over implementing the wrong solution. Can strategic design help executives assess and execute the appropriate steps for their company's return to the office? Most of the worldwide surveys indicate that more than 65% of the workforce expect to work in a hybrid scenario. This, in fact, provides the best of two worlds. Working from home supports people's ability to focus and empowers them with flexibility, while the physical office remains the place to connect, collaborate, and socialize with others. The COVID-19 outbreak has deeply redefined our relationship to public spaces. Fear of transmission, both direct and indirect, has closed schools, restaurants, office buildings, and transportation hubs, and has limited the access to other densely populated locations and shared spaces. We have also learned that COVID-19 primarily transmits through the spread of water droplets from infected individuals, especially in scenarios of close contact, such as prolonged indoor activities. As a result, new building regulations have been put in place that reduce the circumstances in which the disease can spread. These safety precautions include mask mandates, redesign of ventilation systems, and social distancing policies. When we were forced to be confined at home due to the self-quarantine policy of the COVID-19 global pandemic, everyone must have spent a tremendous amount of time looking out from their window. Sometimes, when we are so exhausted with everyday's work and life, we just wish to have a quick getaway to oceans and forests, somewhere close to the natural green. Therefore, designing the landscape around homes has become important. During the pandemic, public spaces have played a vital role in the health and sustainability of urban communities around the world. In fact, people need to go outside now more than ever. In order to equip these public spaces to face the challenges of COVID-19, UN Habitat, with the Block by Block Foundation, has been supporting 10 cities throughout the past year. With the help of local governments and the community, the initiatives helped COVID-proof open urban entities, especially in poor neighborhoods where there are few shared and green spaces. From creating mobile pop-up playgrounds for children in Vietnam to improving livelihood for street vendors in Dhaka to COVID-proofing of public spaces in Bhopal, these responses have provided help to those who needed it the most. You might be surprised by this, but the days of shopping in stores are long from over. In fact, they are experiencing a renaissance and are creating a whole new type of design and experience to bring consumers back through the doors. The rise of e-commerce and the pause caused by the COVID-19 pandemic have served as a perfect catalyst for creating a whole new type of experience through unique design features, technological advancements, and customization that will revitalize physical stores in the future. Let us take a look at the 12 key principles for the effective urban response during COVID-19. First, let us discuss the short-term interventions. First one, public spaces are an important asset in a time of crisis. Public spaces are essential in providing space for the swift and rapid establishment of temporary and secondary facilities, which may be used longer than originally expected, so therefore need to be flexible, multifunctional, and adaptive. Public spaces are a crucial asset in a time of crisis, supporting alternative mobility, providing such important opportunities for recreation and sport, and for many poor people, a livelihood. The second short-term intervention is well-connected and integrated system of public spaces, including streets. With roughly half of the global population under a lockdown or coming out of lockdown, vehicle traffic has reduced dramatically on our streets and public transit ridership has dropped down as much as 80% in some cities. Cities are temporarily and some even permanently relocated road space from cars to provide more space for people to move around safely, creating a network throughout the city, easing movement and respecting physical distancing rules. Creating more walkable streets and investing in greening the city resulted in reducing carbon dioxide emissions and better air quality, which also impacts people's health and well-being and reduces COVID mortality. The third short-term intervention is expand the amount of land allocated to public space, including streets. Physical distancing requires the possibility to leave adequate space between people when out in public space. The amount of land in cities allocated to public space will have to be extended to be able to create more resilient cities. The expansion of streets for active mobility is seen as an impactful measure to make physical distancing possible on sidewalks, particularly in countries that already have high shares of pedestrians walking on inadequate footpaths, such as in informal settlements and slums. The fourth short-term intervention is embrace flexibility of functions. To be resilient in times of crisis, public spaces need to be multifunctional, flexible, and continually adapting to the situation. We need to build resilience through agile adaptation. For example, incorporate temporary food markets into neighborhood spaces, such as parking lots or streets, to decongest existing markets. Transform small neighborhood spaces into pop-up community health centers, spaces for food distribution, or providing space for food gardens in marginalized communities and slums where food is essential. Programming streets and spaces to allow for organized street vending on select days or times of day, ensuring multi-use and shared use of spaces. Repurposing street space by expanding sidewalks to facilitate safe walking, skating, and jogging, and introducing bike lanes to enable safe mobility. The fifth short-term intervention is public space and public facilities can provide essential services required for marginalized communities during a pandemic, providing clean restroom facilities, water points, or appropriate cleaning products that can help unhoused or poor people to protect themselves. Many open spaces in informal settlements can offer hand washing facilities to ensure that families without running water stay safe. The sixth short-term intervention is that public space is important for the livelihood of many, especially the poor. Some of the most affected in the pandemic are poor families, many of whom depend on public space for earning a living. Over 60% of urban employment in Africa is in the informal sector, and each group of informal workers produces goods or services that are essential to the functioning of the economy. During a lockdown, it is therefore important to allow street vendors to continue to operate and provide space for that. Streets can be adapted to provide space for vendors at sufficient distance from each other to sell their wares and providing the street vendors with protective gear to continue to earn a living. Seventh short-term intervention is that public space can be a platform for sharing, that is for connecting places and people. Public spaces that remain open for use provide opportunities to share information about prevention measures such as the importance of physical distancing and hand washing hygiene. Government can provide clear and accessible information in these public spaces as there is a lot of misinformation floating around. These spaces can also provide a platform for dialogue and negotiation to enable the government and the poor and informal workers to discuss and jointly come up with the relevant frameworks to prevent the spread of the coronavirus. Let's discuss the medium and long-term interventions, in which the first one is equitably distribute public spaces across all scales. The pandemic has demonstrated how unevenly public spaces are distributed throughout many of our cities, especially in poor neighborhoods, where there are few shared spaces such as parks, gardens, and playgrounds within a 10-minute walk from home. While parks, green areas, and playgrounds are so important in contributing to reducing stress levels, improving mental health and well-being, and contributing to children's development, they are still considered a privilege. Local governments need to ensure that open spaces are evenly distributed across the city, connected through a web of streets, promoting walking and cycling while embracing physical distancing and guaranteeing the multifunctional flexible use of public space and streets so as to reduce the spread of the virus, but still ensuring that we are not leaving anyone or place behind. The next long-term intervention is plan for the self-sufficient neighborhood or 15-minute compact city neighborhood. With the pandemic and restrictions on movement, the self-sufficient and 15-minute compact city is a model that could contain the spread of the virus as all residents can have all their needs met, be they for work, school, shopping, health, leisure, or culture, within 15 minutes of their own doorstep, not having to venture across the city. This can only function if there is an equitable distribution of essential services, streets, and public spaces. The next long-term intervention is design, materials used, management, and maintenance of public spaces are key in fighting the spread of the coronavirus. The COVID-19 virus can linger in the air and on surfaces for extended periods of time. Public spaces should be designed so as to allow for physical distancing, and public space managers need to ensure that these spaces can be cleaned frequently and thoroughly, particularly on high-touch surfaces like doors, handles, and furniture. The next long-term intervention is building social resilience. The COVID-19 virus has both negative and positive impacts on how people interact with each other in public and as part of the social fabric. The pandemic and the nature of the virus affect the way we socialize. challenging existing cultural and familiar practices, which can create tensions in public spaces. The social and connection elements of public spaces remain important and can serve to strengthen resilience in communities. That is, balconies above streets, where community members gather to socialize with one another, neighborhood streets being transformed into cinemas, theaters, or gym classes. Next principle for effective urban response with a long-term intervention is systematic change doesn't happen without supportive policy. The experience from the COVID pandemic may lead to richer partnerships across sectors, from healthcare to public housing authorities to community development finance and community-based organizations, to philanthropy and research which can influence policy. Creating a shared policy agenda with urban planning, community development, architecture, green building, public health, all have incentives to work towards better policies to reduce the spread of the COVID virus. The impact of COVID-19 pandemic on architecture has been multifaceted. If you want more information on this, please view the next part of this video series. Thank you.